Hey, listeners, we're continuing our series of live bonus episodes from ViVE and HIMSS, where we sat down with industry leaders about innovations and digital trends that are making healthcare easier. Today, you'll hear from Kent Dix, CEO and founder of Life365. Let's get to it.
All right, Ken, pleasure to have you here at ViVE. Can you tell us your name and a little bit about your background?
Thanks. My name is Kent Dix, and I'm CEO of Life365, and we're out of Scottsdale, Arizona. This is my third company that I've done as a startup, second in healthcare. The last one was probably one of the first IoT of healthcare that sold to a $5 billion company. The problem we typically solve at Life365 is to try to economically connect the people outside the four walls of the hospital and trying to keep them out of the hospital, reducing costs. And in this day and age, trying to get early insights and awareness in the data they're producing to be able to run through AI and machine learning models to be able to prioritize patient and prioritize their care.
How do you help a consumer engage in their health?
Most consumers don't want to be in the hospital in the first place. A lot of them, especially my parents, when they were living in rural Iowa, would love to stay in their home a lot longer. They didn't have the economic means to go into, independent living and then assisted living, and they certainly didn't want to go in the hospital on a regular basis. So, I was inspired to be able to create tools to connect the families together to allow them to stay in their home longer, watch their conditions, and then get support from the family. The other part of it is I'm inspired a lot by the new changing models that are out there for care. We're starting to move from fee for service to value-based care, right, and being responsible for the patients. We're fortunate enough to have been able to secure a large subcontract agreement with the VA on remote patient monitoring. It's part of a $1 billion contract over the next 8 or 10 years. It allows us to be able to start connecting veterans remotely. And the one thing we do know is veterans have had a problem in trying to gain access to care on a timely basis, especially those that are in rural locations. And physicians and providers are leaving rural locations. And we need to be able to use technology to start bridging the veterans together and anybody in rural locations to a provider that's in an urban setting potentially to receive care economically. And that's what we hope our solutions do on a regular basis.
Let's talk about something recently. I'm aware of some work that you've been fortunate to do locally. We're both from the Phoenix metro area. Yeah. So what can you tell us about that?
Well, like I said, I've had a couple companies out there. On my last company that I had, NetApps, out of Tempe, Arizona, Scottsdale. We were fortunate enough to be able to start monitoring, connecting with Navajo Indians that were connected to care providers that were in Window Rock, Arizona, but they were in the canyons in Grand Canyon. Their constraints were that they had no electricity and they had no connectivity, right, to be able to send the data. The care coordinators would always have to drive out 60 miles every day just to see if somebody was okay or not, right? So we learned, it's brought to us by a company called Space Data Corporation in Chandler, Arizona, that they floated a balloon above the canyon every single day to do cellular spectrum, right, from that. And so for about a 2-hour period, we'd be able to take glucose readings or blood pressure readings and be able to burst them up to the balloon and go to Window Rock, Arizona, and they would run our device off of a car charger. And then one last thing we did also is we went and got the president of the Navajo Nation at the time, Peterson Za, and he recorded voice on our device to be able to go through and say that the glucose reading is 105, right? But it was in Navajo. So not only did it make for better adoption from that, but we were able to actually take glucose readings from the canyon, down below the canyon, and talking to a balloon 60,000 feet in the air off of a car charger. So that nurses wouldn't have to go out every single day to check on people.
That's incredible. What are some other examples for those who aren't as familiar with Life365 and other opportunities and areas that are just useful for people to be aware of?
Yeah, I'd say our main mission, because some people look at us and say you're fairly broad on what we're doing, but I say we're a data and engagement company. Our purpose is to go out and, what fuels industries nowadays? What fuels, innovation to spark major trends, trillion-dollar trends in innovation? When the PC came out, it sparked all these apps like financial apps and everything else that came out to be built around it. When the smartphone came out, it fostered Uber and, Grubhub and a lot of other financial apps that went on it as well. So what is the main thing that's going to push healthcare forward? And we've been around this for years now to see, is this the inflection point? It's definitely AI. AI is going to push healthcare immediately forward. On top of the fact that we're in an aging population and we're losing care coordinators, right? I mean, we're going to lose 800,000 care coordinators by 2027, right? Our spend on healthcare could be above $6 trillion in the next 3 to 4 years, right? From that standpoint. When I started, it was $2 trillion. Now it's like $4.5 trillion, and with a bullet going up because we're an aging population. Technology is absolutely going to play a role with us. So as a senior professional in this industry, my role very simply is to make it easier for the healthcare system to get access to the data. Because one thing you can think about is that a lot of things we do, especially in digital health, is more in a reactive mode, right? We wait till people go to the emergency room, we wait till they get discharged from the hospital, then we give them the device, and a lot of times it's at end of life or near end of life, right? So, or complex care. We want to shift completely left and start getting people much earlier. And I'm inspired by a book by Dr. Leroy Hood, which is called The Age of Scientific Wellness. And he talks about the 4 Ps. He talks about preventative, proactive, personalized, and prioritized care. So if you can start getting data early on and running it through the AI system that's out there, now you can start prioritizing people days, weeks, months in advance, right? To go through and say, maybe you don't want to look at, at Jared today, but maybe you want to take a look at Kent. Because the last time his blood pressure was above 180 and his SpO2 was below 85, he hit the emergency room within 7 days. Maybe we should send a fast response team out to him instead of sending an ambulance instead. So data is going to play an incredible role going forward.
Maybe we are at an inflection point, like you're saying. Are there specific types or parts or topics of AI that are of interest or that you think are going to propel this even further?
The part we concentrate on is just making sure we have good, clean data, right?
This is
Life365.
Yeah, and this is personal health, or which data are we?
Well, it's the data for chronic care management, right?
Okay.
And to try to shift left, right, to be able to do that. So, the data has to be somewhat timely. It has to be actionable. It has to be cost effective, right? Do right data, right time, right outcome, right price, all the rights that are there. So our mission is to get that data to feed the AI systems. I always use the rhetoric and say doctors don't need any more data, right? They just don't. In fact, they look the other way when I'm coming, right? From that standpoint. Or most RPM companies, because they just don't have the time to absorb another thing in their practice to take care of patients, especially if it's questionable if they're going to get reimbursed for it or not, right? So the health system has to go out and interface to 500 different device companies or digital health companies, and they have to go through evaluation, they have to go through integration, they have to go through certification, they have to go through contracting. It's just going to take forever to get there, right, to be able to do that. An average digital health company going to a health system is probably 12 to 18 months to get on board, right, from that standpoint. If you can go in with one connection point, a health system can, into Microsoft Fabric and be able to do it on HL7 or Fire and be able to get access to, voice biomarkers and labs and vital signs. And like we interfaced over 500 different medical devices and have over 500 different medical devices from one connection. That's a huge saving. Yeah. So platforms are going to play an incredible role in taking a lot of things we're seeing ViVE and putting them plugged in to a platform that then can be consumed by a health system or provider or payer.
So you mentioned maybe it's those 4 Ps. Is that what consumer-centered care looks like to you in general? How would you even define or describe what that is? Is it kind of referring to that prioritized, personalized, those 4 Ps you described?
It's more about, the saying is like, who determines how healthcare is driven nowadays? And it's the payer and it's the consumer. I think it is, right? To make that decision from that. They are voting, the consumers are voting with their dollars, right? To be able to do stuff. And with that, it means that you've got to have a level of personalization that meets the consumer's needs. You've got to meet them on their terms, right? To be able to do that. So with me, I've got 3 big screens in front of me at home. And from that standpoint, that's where I kind of want to meet my doctor. I don't want to go in for an exam and then go back for a test and then go back for the results, because that's how the doctor's paid. My time is very busy, right? From that standpoint, the likelihood of getting me one time, in there is pretty low, right? From that. So if you can get me behind the computer and be able to start giving me numbers that I can start managing from that, then I'm a happy camper. I've started doing, self-empowerment, and providing data to people. Not everybody's going to react to it. But I personally, we all go through cycles, right? I mean, I'm either losing weight or I'm not losing weight, or exercising or I'm not exercising, right? From that standpoint. But I'm very interested in my numbers on a regular basis. And the more that I can take care of my own numbers, like I'm wearing a continuous glucose monitor right now. Do I need to do that? And the answer is no, but I'm a digital guy. And I was curious about the data and how it affects GLP-1s and weight loss and blood sugar and exercise and my labs and all that kind of stuff. The more that we can empower consumers with their own numbers, the better, right, to do. And, being able to go to my doctor or go to my specialist when I really need them to kind of guide me down a certain path. But we need to give more of that data to consumers to be able to manage their own care.
I'll give you a final word here. Anything we haven't mentioned yet or talked about yet that you'd want to make sure our listeners are aware of, or any message for them?
No, I would say the traditional people that we look for to kind of work with, we're very excited about the VA contract. We're very excited about Microsoft. We're doing a very big faith-based organization that we're working with, where churches are supporting their congregations, and we're starting to give them tools to manage their congregations, which is great. And we've been very, very fortunate to have seen the vision many years ago and have a very strategic portfolio and patent portfolio in AI and wearable technology and sensors that are out there. I really believe that's where it's going. The other thing that to shift left, we've got partnerships that we put together with people like Canary Speech that do voice biomarkers. There's others that do facial acquisition of data. And I know the facial acquisition of data, there's a lot of companies trying to use the smartphone or the computer to get vital signs from your face. But there's a lot of things you can do with that before it's FDA cleared. There's a lot of things you can do with that data from an AI perspective, not showing it to the patient, not showing it to the clinician, to be able to nudge is my big key, to nudge them into compliance, right? By using simple traits that are coming out of you, right, from some of the vital sign data that's out there. That's really important to keep people compliant. So we're all about data and engagement.
Really appreciate the time, Ken. Thanks for giving us so much to think about.
Yeah, thanks, Jared. Appreciate it.